I'm Dr. Sheryl Martin-Schild. I'm the Medical Director of Stroke and Neurology at Touro Infirmary. You can reduce your risk of stroke by implementing a few lifestyle changes. You can reduce the amounts of salt, cholesterol, and complex carbohydrates in your diet. This will help to control blood pressure as well as cholesterol and glycemic control if you have diabetes. There are other things that you can do, like exercising at least 30 minutes, at least 3 times a day. This also helps to control blood pressure and to control weight. Now, weight is a risk factor for stroke along with high blood pressure, diabetes, and high cholesterol. And weight management is important to help achieve the lowest risk of stroke. Not smoking, not drinking excessively, and never using any drugs that you're not supposed to use, like cocaine and methamphetamines are the worst, or any injectable drugs, can help to greatly reduce your risk of having a stroke. A person can identify your personal risk for stroke by having a primary care doctor and working with your primary care doctor to identify your risk factors. The earlier you learn about your blood pressure being out of control, the earlier you can implement blood pressure reduction to overall reduce your risk of having a stroke. The single most important risk factor for having a stroke is high blood pressure. This accounts for about 45% of all strokes. Everyone is at risk for stroke. Almost every person in the United States has at least one risk factor. And risk factors for stroke are not just additive, they're exponential. The more risk factors you have, the higher your risk of stroke. You can go to stroke.org and plug in your risk factors into a calculator, and it can tell you what your expected risk of having a stroke over the next 10 years is. You should work with your primary care doctor to get all of your stroke risk factors that are modifiable under control so that you can reduce your long-term risk.